Welcome to another short educational video from the League of Women Voters of Appleton's Climate Change Preparedness and Resilience Study. We know people's health can be compromised by breathing polluted air, and we realize that people with mobility issues can have specific needs regarding access to their housing that also can affect their health. But there are numerous other situations based on the location of what would be otherwise considered safe housing that can affect people's health, making them actually unsafe. This presentation details just a few examples of the myriad of ways that specific locations of otherwise safe housing can impact people's health regardless of the housing structure. PFAS, pipelines, and CAFOs. This schematic shows how PFAS chemicals, or perfluoroalkyl substances, spread from manufacturing plants to residential areas and the surrounding groundwater. Groundwater can find its way into nearby waterways that may supply cities and towns with their municipal drinking water. People living in nearby rural areas may have wells that could become contaminated by this groundwater. Since the development of these complex chemical compounds in the 1930s, 90% of Americans have absorbed PFAS in their blood systems as of the last 20 years. As PFAS resist photolytic, biological, and chemical degradation, they will be with us and continue to accumulate in our bodies for the coming millennia. The 2019 documentary film Dark Waters documents PFAS as cancer-causing agents. The movie was based on the book entitled The Lawyer Who Became DuPont's Worst Nightmare, a true story. PFAS are still used in the manufacturing of fire-retardant foam. Passed in September of 2019 on a bipartisan vote, Wisconsin Act 101 restricts the use of foam-containing compounds known as PFAS to emergency situations and testing facilities with, quote, appropriate containment, treatment, and disposal measures, end quote. Efforts to pass stricter limits on the use of PFAS have been met with firm resistance by the powerful Wisconsin manufacturers and commerce lobby. Quote, the public is sick and tired of money and profits being put above the health of our communities, said Peshtigo resident Jeff Lamont, who has had to drink bottled water since his well was contaminated with PFAS. Quote, if these are the people who are Wisconsin business leaders, God help us, end quote. Jennifer Geigerick, Government Affairs Director for Wisconsin Conservation Voters, said of a recent proposed rule that it represents a minimal effort to prevent a public health crisis, noting that PFAS have been linked to cancer, liver disease, and low birth weight. Even more recently, Wisconsin Department of Health Services announced their recommendations for new groundwater standards for 22 contaminants, including some PFAS and pesticides, that they say will ensure safe drinking water for Wisconsin residents. Given 90% of Americans already have PFAS in their blood, it's probably safe to say there will be a lot of people dying prematurely. If this health and environmental issue is something you feel drawn to, talk to your legislators and/or connect with local health and environmental activists to find out if they're talking about supporting the newly suggested standards regarding PFAS in drinking water, or are working on ideas for management or remediation of PFAS. While not in our study area, this is another example of how safe and affordable housing can become unsafe by virtue of its location. This kind of situation is unfortunately not unheard of for Indigenous peoples living on federally designated lands. The Bad River Reservation on the Wisconsin shore of Lake Superior has an oil pipeline running through it. And while the plan is to remove the buried pipeline from the reservation lands, as shown, the proposed relocated pipeline will then cross several more forks of the Bad River, increasing the likelihood of contamination within the Bad River watershed area. That might compound the risk for contamination of drinking water for people living on the reservation and nearby, should there be a significant spill. Wisconsin has over 100 gas and oil pipelines crisscrossing it. Presumably, none of them run through gated communities. Oil and gas line ruptures happen and could very well be health hazards to people living nearby. In any case, the Bad River Band of Lake Superior, Chippewa have made it clear that they want the pipeline to be removed from reservation land. Since 2000, an increased number of agricultural facilities that house and feed large numbers of animals in a confined area, known as Concentrated Animal Feeding Operations, or CAFOs, have located in Wisconsin. This approach offers a more efficient system to feed and house animals through specialization, increased facility size, and close confinement of animals. They also pose increased environmental and health problems for neighboring properties and communities. Because more waste is generated in CAFOs than other less dense animal farm facilities, the potential for air, water, and land pollution increases in nearby areas. When appropriately applied to soil, animal manure can fertilize crops and restore nutrients to the land. When improperly managed, however, animal waste can pose a threat to human health and the environment. Potential pollutants associated with animal waste include nutrients such as ammonia, nitrogen, and phosphorus, organic matter, solids, pathogens, antibiotics, odorous or volatile compounds, and trace elements such as arsenic and copper. According to the Centers for Disease Control and Prevention, these pollutants can directly affect human health and can encourage the growth and development of potentially harmful plants and organisms. CAFOs typically have 1,000 to 6,000 animals. In the case of cows, 6,000 cows will produce 70 million gallons of manure a year. Typically, the manure is kept in lined ponds. Methane gas is produced by the cows and the manure in the ponds. Some CAFOs use manure to produce electricity using methane gas in biogas digesters. This process helps deplete the methane gas on site. In terms of climate change, methane gas is considered to be a more damaging greenhouse gas than carbon dioxide. Due to the increased occupational, environmental, and community hazards posed by CAFOs, state, local, and federal authorities regulate them. In Wisconsin, initial legislation regarding CAFOs was passed in 2004, when there were 50 in the state. Since then, the number has grown to 320. Wisconsin DNR charges the lowest annual application fees for CAFOs in the Midwest. Annual permit applications are supposed to be reviewed and on-site evaluations made. Reportedly, that has not been done consistently, and the DNR has been known to use the funds from these fees for non-CAFO related things, leaving the fund unable to cover expenses for inspections. Thus, they are not being consistently monitored. With so much manure, how can we protect the quality of our groundwater? Likewise, with more methane being produced by CAFOs and escaping into our finite warming atmosphere, should there be limits as to how much manure they can produce annually if they don't have biogas digesters? And knowing that limiting the amount of manure will effectively limit methane. There are state statutes that address proper animal waste management, but environmental groups are concerned that not all CAFOs are following them. Here are some suggestions. Lobby for adequate DNR staffing and budgeting to allow enforcement of reviewing permit applications and doing the on-site evaluations. Lobby for increasing the CAFO annual application fees to help cover the cost of staffing on-site evaluations. and make Wisconsin a less attractive place to locate. Encourage a scientific evaluation from a climate change perspective as to the real danger CAFOs pose, given the limited time we have to slow the warming trends of our fragile atmosphere. Low-income populations are vulnerable by definition due to their limited housing options and financial resources. Coupled with physical limitations or chronic health problems, it makes their finding safe and adequate housing that much more difficult. Those with severe asthma should not live in housing bordering freeways or other areas surrounded by more heavily polluted air. Mold in housing, possibly resulting from flooding, can be dangerous, especially for people suffering from Lyme disease. So what is safe housing for one may not be safe for someone else. People who can only afford to live in the midst of food deserts in larger urban areas and do not have a car need affordable transportation options, especially in winter in Wisconsin. One of the issues highlighted by the current COVID-19 pandemic is ordinary safe housing spaces in nursing homes, jails, and prisons become super spreader conditions due to the usual closeness as dictated by the layout of the facilities. In such cases, the health for residents and personnel are all at risk, as we have seen. So what has served as adequate and safe housing in previous years is not now. For more information, this is a list of the resources used in the creation of this video. We hope this discussion of vulnerable populations has made it easier for you to see how troubling not being able to find adequate housing that's both safe and affordable might be. Those of us who are fortunate enough not to have those worries are in a better position to push for more affordable housing. In Appleton alone, there is a 40% shortage of affordable housing. Want to be part of the solution? Consider joining the League of Women Voters or an environmental justice or other social justice group of your choice, and help our legislators focus on basic needs of so many people located in the Tri-County area.